Hi, everyone. If you have seen my message, this is Cindy Huber. If you could type in the chat. Hi, Ron. There you are. We see you. If you're comfortable, let everyone know where you are. And if you're a recipient, family member, an advocate, that would be great. We'll be starting in just a few minutes as people join us. Thanks. We're going to give people just a few minutes. People are still logging on. And for those of you joining us on Facebook tonight, welcome. My name is Cindy Huber, and I'm the CEO of the National Kidney Foundation of Wisconsin. Hi, Jennifer. Welcome. If you feel comfortable, if you want to type in the chat, let people know where you are tonight. That's great. You'll see on the slide just a few of the guidelines that'll be helpful tonight during the program and as you might have questions. After tonight's program, you will receive a little survey about tonight's program and an opportunity to give us feedback about some future topics. And so it's helpful if you do put your first name and or first and last name if you're comfortable, so we can make sure that the right person gets the survey. And tonight helping us, we have John Hacker and my colleague Amanda Pollock. And Amanda will be monitoring for those of you who have joined us tonight on Facebook. If you have comments, Amanda will be monitoring those and providing those. Thanks, John, because my hair looks better there, so I appreciate that. Amanda will relay those to our guest speaker tonight, and John and I will be kind of watching the chat, and John will be also watching for any assistance that you may need. So I think we'll go ahead and get started, Andrew, if that's all right. But first of all, for those of you that might have missed it, I'm Cindy Huber, and I'm the CEO of the National Kidney Foundation of Wisconsin. So welcome to our Living Well before and after transplant programs. These, for those of you that might not have joined us before, these are monthly programs that we offer to keep us connected in the transplant world, the organ donation world, and also on behalf of patients throughout the state of Wisconsin. And for those of you joining us from other parts of the country, welcome. It's an opportunity for us to come together and to learn about things that are happening that affect us in the world of transplant, organ donation, as well as kidney health and other chronic diseases. Tonight we're really excited, and I think this is a really timely topic in terms of advocacy. And a good friend and a good colleague of mine at our national headquarters is our guest tonight, Andrew Fullerton. And Andrew, I could say a lot of things about Andrew. I was pretty excited because when you see his PowerPoint, you'll see, because I'm a dog lover, I'll just say that. So I was like fully excited that I'd have something unique and different to say about Andrew tonight. But he'll explain the picture in his PowerPoint. But I do think Andrew is a dog lover, and I'll let him verify that tonight. But I will say that over the years, I've had the opportunity to work with Andrew, who is a very patient-centered advocate on behalf of patients throughout our country, working in our governmental affairs office, our public policy office in Washington, D.C. And he brings years of experience and an in-depth knowledge. Andrew has joined us throughout the years, but I asked him tonight, given the fact that we are coming up on an important time as the calendar year winds down in terms of some very important initiatives that affect living donors potentially and transplant recipients throughout the country. And so I asked Andrew to give us a little, if you will, update on what's going on, but also, I threw out the question to him, is now really a good time to be an advocate, or is everybody distracted and doing other things? So Andrew's going to be asking and answering that question and answering your questions tonight. So with that, Andrew, I'm going to turn it over to you, and John will advance your slides. But thank you so much for joining us. And first and foremost, who is that handsome guy or gal that's in the picture with you, Andrew?
Yes, I am a dog lover. I grew up with 2 Brittany Spaniels, grew up bird dogging. I unfortunately don't own a dog living in an apartment. I always thought it was unfair. That being said, a friend of mine raises service dogs and trains them as a second job of sorts. And she brings them with her, as you should, a service dog, to conferences and other events, and I get to meet all of her service dogs whenever I see her. So that was one of her dogs about 2 years ago that I had a particular fondness for. So yes, as Cindy said, I've been in the government affairs space for a long time, about 18 years now, with NKF for a third of that time. I've had the chance to work in Congress, on the campaign trail, trade association world, and elsewhere. So I hope you will definitely ask me as many questions. I hope and look forward to answering any questions you have to the best of my ability. Next slide. The reason why we are really pushing advocacy and encouraging you to become an advocate in every way, shape, or form is, I think, highlighted by this very simple slide. You all have great ideas. Cindy has a great idea. John, others have great ideas. Those don't become policies unless you go to someone like the congressman who's in this photo with that great idea, which then becomes a bill. So it is extremely important that we all get to know legislators, but also so that we educate them and make them aware of how big an impact kidney disease has on the communities that they govern, that they represent in Congress, or at your state level as well, or at your town and city level. So this is really why we're having this presentation at the end of the day. And the other great thing is, every now and then you find a great legislator who has a connection of his or her own to kidney disease. In this example, he's a congressman from New Jersey who is a dialysis patient and on the transplant wait list. He's been on for, I think, 2 years now. And we've done a number of briefings at the state level, for example, with legislators, and we found that there are a lot of legislators out there who are eager to engage with our patient community, eager to push kidney policies that will improve how the patient community is treated. But they haven't been asked to, they haven't been approached, they haven't been given that opportunity. So with the next slide, the first step is really engaging as voters. We hope that you will go out and vote. We hope that you'll go out and meet the candidates on both sides, that you'll talk with them about kidney disease and why they need to care about people like yourselves. But the first step is really getting out and talking to candidates and going out and voting. It is extremely important, and that is one reason why NKF this year launched a website, votekidney.org, to give you some of the information you need to do that. So on this site, you'll not only find who your federal candidates are. I apologize, it does not have state officials, but it does have federal. So that's your U.S. Senator, your U.S. Congressman, and then of course President. It also has information on how to register for an absentee ballot. It has links to to the place you need to go to do that. It has some tips on voting safely if you have to go in person for whatever reason. And it also has other information, such as if there are any first-time voters here, or someone who has moved recently and is voting in a precinct for the first time, you will have to bring certain information like ID and billing. So you'll find a lot of that information on this website. It also has dates as well that are important for your state, such as cutoff for absentee ballots or what your primaries are, etc.
And Andrew, it's by state, right? So I'll be able to click on Wisconsin, or if I share this information with a friend in Montana, they would be able to click on their state, correct?
Exactly. So you can either click on the map that you'll see in that screen, or you'll click on that little drop-down bar you can see underneath the map, select your state, and then you'll type in your address, and it will populate the federal offices that, and candidates, as well as other information for your specific state.
And one thing I noticed when I went on the site, Andrew, that I really liked is it did have links to the candidates' website if a candidate had a website. Yes.
And it's continually being updated with new information as debates are scheduled, as other things happen, that there's new information being added to this website. So it is growing, it is ever changing, but we hope that this will help you engage this election, because there will be a lot of change this election on both sides of the aisle and in every level of government. So it is extremely important that we make our voices known, both through our vote and both through our voice. As I said, in meeting these candidates. So on the next slide, these are some of the things that we are pushing at the federal level, and one example of something we're pushing at the state level as well. And these are some of the reasons why we need to have legislators aware of what we're trying to achieve and why we're trying to achieve them. So with this example, you are probably aware that the government funds a significant amount of healthcare research and programs. One of those things is the Kidney Risk Campaign. It's a new campaign that stems from the administration's what's called executive order for the Advancing American Kidney Health Initiative. It is a partnership between NKF, a group called ASN, which represents the nephrologists, and the Health and Human Services Department, HHS. And the purpose of this is to drive awareness of kidney disease in the general population. The initial stage of this is through a social media drive and website that you will go to, and you'll do a quiz which will then say, here's your risk of developing kidney disease. And here's some information if you're at risk, and what should you do? Who do you talk to? Provide you a lot of that information that a lot of people don't get. I'm sure we all know someone who didn't know they had kidney disease until they crashed into dialysis, for example. And even at that, their primary care physician, for example, may not have known that much about kidney disease. So we're trying to make sure that they're properly educated and they have the information they need to take care of themselves as early as possible. And for example, with this partnership, we are seeking for Congress to fund this for the first time for $10 million. But there's a lot of other programs out there that the government funds that we are also supporting. On the next slide, this is something that we are very proud of, the advancements that it has made. And These advancements are for two reasons, and one of the biggest reasons is because advocates have driven this forward so heavily. Those of you who have a transplant may be aware that after 36 months, Medicare's coverage of kidney transplants goes by the wayside, and you will have to go to a private insurance unless you have aged in or are disabled. And some patients have a lot of difficulty paying the rates that private insurance costs, or mandates that you pay for these medications. They have a lot of trouble paying for insurance. Sometimes people end up skipping doses, for example, or they can't afford the medication, or something else that could put their kidney transplant at risk. So what this does is it would extend Medicare's drug coverage of kidney transplants indefinitely for the life of a transplant. And as I mentioned, the other thing that really has helped this along, this has been a bill that we have been pushing at NKF for about 2 decades now. There's a lot more data around kidney disease, courtesy of a lot of the programs the government runs through agencies like the Centers for Disease Control, or HHS, and Medicare and Medicaid Services, CMS. And that data allowed us to figure out what this would do to the budget. And the Congressional Budget Office showed that this would save about $70 million over 10 years to the government. So this has allowed us to say, look, this is fantastic for the patient community. It'll help patients keep their kidneys, improve their quality of life. This will also save the government money. So one of the other things that we push with all of these priorities is for you to write your legislators emails. We have a great site, advocacy.kidney.org, that you can go to write your legislators on these priorities. You may, if you are already on our mailing lists, whether it's Cindy's or ours, have gotten emails or paper copies of these letters that you could sign. If you haven't already done so, we do ask that you do so as soon as possible and personalize these letters. I'll discuss why in a moment. So the other priority on the next slide is the Living Donor Protection Act. This is something that we have been pushing for about 5 or 6 years now. We have heard enough stories about this that it became a concern to NKF that life, long-term care, disability insurance were discriminating against living organ donors, in our case, kidney donors. There was a Hopkins study done a few years ago that showed about a quarter of those transplant, or those donors that donated through Johns Hopkins reported that they were discriminated against in some fashion, usually higher rates or denial, when they tried to obtain or change their life insurance. And this study was specifically on that. And we have a number of patients who are advocates with NKF who have had this happen to them. One of them, for example, who is a advocate out of Missouri, and we have a video of him talking about this on our website, had a $500,000 plan, life insurance plan, prior to donation. His wife needed transplant, so he donated to his now deceased wife. And then after donating, sometime later, he tried to get a $250,000 plan. So he had been, for that $500,000 plan, he had been paying a premium of $466. When he went back for a plan half that size, they were trying to charge him, after initially denying him and him having to fight to be accepted, they tried to charge him $25,000. This is not a common occurrence. It's something that a few disreputable folks are doing, but it's something that shouldn't happen. And this is something that even the life insurance industry, for example, recognizes shouldn't happen. So they've been supporting the federal bill, and they've supported our efforts at the state level as well. And we've been able to pass a number of these bills at the state level while we're waiting for Congress to act. And you can see the list of those states here. And most of these states were done solely because of advocates who had built relationships with their legislators, either meeting them during election periods, meeting them throughout the year outside of the election. They built relationships with legislators at their state level. And in some cases, such as I believe it was Colorado, for example, we had and I know there's a bill in Pennsylvania which is not yet passed, living donors are pushing those bills. In Arkansas, we had a living donor and a recipient, and a person whose wife was a donor pushing the bill. That happened elsewhere in the country as well. So the connections that our advocates made this possible and made those protections possible. So on the next one, this is the perfect time to be an advocate. Legislators are up for election, and they're listening to you like never before. Whether they're running for office as a sitting official or whether they're challenging a sitting official, they want to hear from you more than ever. And they are out on the campaign trail. They're meeting with chambers of commerce, with patient groups, with practitioner groups. They're meeting with Kiwanis and VFW posts, et cetera. They're out there. So this is why this is the best possible time to be a patient advocate for our community. They want to hear from their constituents more than they want to hear from someone like myself. It is far more effective than you can believe to have patient advocates go in and educate their staff and the legislators. In some cases, some of our advocates have gone so far as to become advisors to their legislators on healthcare, what we call kitchen cabinets, unofficial advisory groups that they run. Because the legislators realize they need to know more about how policy impacts the patient community, something that has been overshadowed by other focuses for many years and has finally broken out into the sun itself as its own role in advising legislators. So the other thing that you can do is you can humanize the facts, the figures, the dry things that we may throw at their staff here in DC. You can put a face to kidney disease. You can put a face to donation or to dialysis, to receiving a transplant. You have stories from either yourselves or your family members, from your friends who may be patients. And those stories make a huge impact on how they view the disease. I have seen legislators and staff crying after meetings on Capitol Hill after meeting with patients because they were so moved by the story. I've also seen them so aghast at something like the immuno bill, which I pointed out earlier, that was an issue, that they didn't believe the advocates in the meeting and had to have their staff double check what they were being told, because they couldn't believe that was such a bad policy existed. So your stories are what make change happen. So the next slide. There are a number of ways that you can engage. We talked about writing letters to legislators. We talked about voting. We talked about meeting candidates. There's also groups like the Kidney Advocacy Committee, which is a national group of kidney patients who serve as advisors to NKF on policy, but they also serve as educators of legislators and communicate to legislators and other policymakers, whether they could be regulators, for example, about the questions, the concerns, the stories, the policy changes that need to happen. And they, as this slide talks about, do represent the full spectrum of the community. We also have our advocates engaging with companies, with task forces, and many other organizations out there that are interested in learning about kidney disease and how policy affects them. A good example of this is about 3 years ago, the Food and Drug Administration wanted to educate their staff about how the work that the staff were doing impacted everyday Americans. So they came to organizations like NKF and said, can you have a couple of your patients come in and talk about, in this case, transplantation and how the policies that we're doing through FDA impact them as patients. So we had 5 or 6 patients go in and serve on this panel that they were hosting to talk about how certain policies impacted the patient life. We couldn't have done that without patients being involved in things like the Kidney Advocacy Committee. So, and on the last slide, I will highlight one more thing. There are a lot of ways that you can follow what we're doing at the national level. We have a blog, we have a advocacy Twitter account, which you can you can follow. And we hope you'll do so that you can stay aware of what's going on and you can share with your friends, your family, with legislators, what is going on and why they need to be concerned and be working on changing policy, whether it's as a legislator or as an advocate itself. So I know, Cindy, I did answer your question, but I'm hoping that you'll have other questions about this presentation and maybe even other questions about ways that advocates can get engaged locally with you or in the election even.
Yeah, so I'd welcome anybody to type anything in the chat at this point. Andrew, could you talk a little bit more when you talk about engage now? The thing that occurred to me was if I sent an email 2 months ago, should I keep sending an email? So is once enough? And then can you tell me and tell us a little bit more about, and maybe you answered this and I overlooked hearing it, but what happens when the calendar, when we turn the page from 2020 to 2021 with those bills that you were highlighting earlier? So if you could kind of just address those 2 questions again, and I apologize if they're redundant, but
they are not.
I'm like, if I let's say I might have written 6 months ago because I, heard about the Living Donor Protection Act, or I know people like Ron Walsh has done some advocacy, and I see some other folks that have joined us tonight. Can you talk a little bit about both of those topics for me?
Yeah, so we definitely want you to write multiple times. It means that they're going to keep focusing on our policies if they get enough constituents contacting the office. And one of the things I didn't include in this deck is some examples of just how many different numbers of people, the number of times people need to reach out. So for example, for emails, a legislator might need to receive 25 to 50, even 100, depending on the level of governance he or she is at, emails before they really push hard on moving forward in supporting policy. On social media, it only can take 10 to 30 tweets, Facebook posts, and other social media tags before they're active on it, which is one reason why we love social media so much. And the other great thing about social media is on Twitter, for example, if you tweet at them, everyone who follows that legislator's Twitter account or Instagram account or whatever it might be, also will see what you're posting. And maybe you can attract their attention as well. So, but the email is only the tip of the spear. We talked about meeting with legislators, for example. That is your next step. After sending 2 or 3 emails, you should definitely be calling and saying, I would love to meet with Congressperson or Senator so-and-so or their staff member to talk about kidney disease policy. And then you can come to someone like Cindy or myself for the fact sheets and talking points that you need to make it as effective as possible. Because an email only goes so far, but by developing that personal connection, you can single-handedly sway how they view policy and whether they're aware of policy on top of that. So as to the second question, at the end of this year, everything dies. So we got to start all over again after the election next year. And that means that it is even more important than ever that we push harder on Congress to take action on these policies. That's why it's more important that you meet with them, that you write them, that you call them, that you have everyone you know do the same thing. For example, we are going to be hosting more than 160 advocates now, I believe, virtually to meet with legislators next week in hopes of emphasizing the need that the community has to push these forward. I saw we had a couple of questions.
Yeah, there are a couple of questions. And are you able to see those? And Gary,
if you want to read them off, so people who are listening.
So some people are on the phone. And Gary Shea, I don't know if do you want to be unmuted, Gary? Or are you okay if I read it? I'll start reading it. And then Dan, I see you have one too, and we'll get to yours. So Gary, I'm going to just start reading if that's okay until I see something in the chat. Oh, he says, okay. So can we unmute Gary Shea?
Hello, actually, I don't need to speak.
Oh, yeah. Do you want to say your question, Gary? Because there are some folks just on the phone that might not be able to see your comments.
Yeah, okay. Yeah, I'll just read it. It's kind of a complex question, right? Or as written. Coverage of the cost of immunosuppressant meds by Medicare Part B is provided to those that had the transplant while covered by Medicare. So my question is kind of multiple part. How did it come to be like this in laws? Instead of providing coverage regardless of who paid for the transplant, the important factor being the recipient is now on Medicare and taking immunosuppressants. So it's not just the 36-month limit for kidney transplant recipients. If they hadn't been on Medicare when they got the transplant, they wouldn't get the Medicare Part B either, for example.
So I can answer part of that in part, at least on the history side. I actually have never heard a firm reason, so I don't know that anyone knows exactly why any longer that it is in this particular way, like why there's a 3-year cutoff. I've heard everything from there was a cost element to it that people were concerned about because people just didn't have any data, so they were just estimating what the cost might be, to one that is probably, most likely is they took, when a lot of these programs were created, they took older programs that were in existence and modeled them after those older programs. So there is a lot of language that just was holdover from some earlier program. And as a result, we have to come in on the back end as advocates and change and improve the policies as they were created. And this is one of those examples where we need to do that at the end of the day, for whatever reason why that policy was created as it was.
So Andrew and Gary, I actually might have a little insight to that because I was actually reading some documents this weekend for something else I was researching on some of the history of the National Kidney Foundation of Wisconsin. And it's interesting because Wisconsin, advocates from Wisconsin played a key role in terms of even having Medicare pay for dialysis. There were some physician volunteers who kind of helped lead the charge, if you will, along with other advocates, many years ago. And at that time, the number of individuals that were actually affected by transplant, Gary, and was much smaller. And so I think, Andrew, it's maybe a combination of what you articulated before, but also the fact that the numbers in terms of even number of people, for instance, on dialysis, and that's why there was a thumbs up to have dialysis covered, you know, but under Medicare, but where transplant was at during those early days. So I think it's kind of a combination, but I think the N, if you will, the number they were dealing with, you know, the math, they just didn't know that the success, if you will, of immunosuppression, the success and longevity of transplant as an option, et cetera. So I think it was part of the time. I don't think it was, I think it was making the best decision they could at the time, and then, you know, using the information that they had is kind of how I'm putting the two pieces together.
Would you consider it a bigger problem that those that have had transplants before they got on Medicare don't get that coverage than the 3-year limitation?
Well, Gary, do you live in Wisconsin? I don't know. Yeah. So in Wisconsin, what kind of advocates did here years ago was establish, so in our state, this limitation doesn't have to be as devastating as it is in other parts of the country for recipients that you're talking about. But in our state, we actually have a safety net, the chronic disease program. So in our state, a transplant recipient would never have to go without coverage in the state of Wisconsin. But that is, as I think, Andrew, there are very few chronic disease programs like Wisconsin's. I know there used to be about 13 states that also had that secondary safety net. But advocates years ago here in Wisconsin, Gary, actually, I don't know that they knew the future, but they wanted to make sure that should our federal government make different decisions, that there would always be a safety net here. So that wasn't really a very direct answer to your question, but in Wisconsin, we do have a safety net. Not that we shouldn't advocate for all, as Andrew's saying.
Yeah.
So, and Dan, I think you had a question. I think Dan's question was, Andrew, could you just go over that website again that showed the map for contacts and talk a little bit about that again?
Sure. So vote.kidney.org. What you'll do when you go to that website, you don't need www or anything like that, just vote.kidney.org. You can click on either your state or on that drop down below in the picture you see. You can select your state. And when it'll pop into your state, it'll have a series of, let me actually open it myself, just so I can make sure I have all this right. I'm going to open Wisconsin, actually. So what'll happen is you'll get a state page, which has candidates, basic information, which is your voter ID information, things like that, that you'll need if you're a first-time voter. Information on how to register to vote, and it also has a separate tab for how to apply for an absentee ballot. There's a number of different ways that can be done in different states. And then if you type in your address, what will happen is it will show all of the federal legislators that are running for office in your district. And it also, as I mentioned earlier, has some of the key dates for Wisconsin, for example, like the deadline is October 30th for absentee ballot requests. So my hope is that, if you, for example, are on immunosuppressant medications, then you might consider voting by ballot, just to stay a little bit safer by absentee ballot. but you'll need to do that before October. You'll need to register before October 30th. So right now it only shows the presidential race. However, if you were to type in the address, someone's address, for example, it would show House and Senate races. You don't necessarily have to do it now, but just to give you an example.
So if there's a change in Wausau, Wisconsin, we would see that.
Yeah, so we try the vendor we use for this is keeping this as up to date as possible. So, for example, key dates. If somehow or another a new candidate were to pop up, and maybe an independent, for example, that kind of information would be added to this website. And we are also always adding things of our own. For example, the healthy voting section at the bottom, which was shown us a few minutes ago, in the orange. There you go. That was something that was added actually at the suggestion of an advocate who was interested in learning more about some basic tips on voting more safely. And we're continually updating this site. So obviously, if you have any good suggestions, please send them our way, because we would love to hear about them and upgrade this even further.
So Andrew, we had another question from Richard Masterson. Richard, I don't know if you'd like to ask it yourself, or are you okay with me reading it? I'll go ahead and read it then. This is from Richard. He said, you mentioned that of the 3 initiatives, one has been working for several years. What is the process of moving bills through Congress, and what delays the bills from advancing?
That is a very long question. So actually, one of the slides I thought about adding was a slide on how Congress works, just to show you how convoluted Congress can be, even when in a
yeah, I think that would be a very interesting slide, actually.
I was hoping not to bore people with a Civics 101 class. But so the basics of how Congress works. Someone comes to Congress with an idea. So for example, myself or one of you would go to your congressperson and say, we need to protect transplant recipients by making sure they get medications and can afford them. So we go with a concept, or even legislation itself. For example, I would always try to go with actual legislation that they could look at and analyze. If you can make it easier for them, they appreciate that, as you can imagine. Then they will go through and analyze that legislation or that idea. If they need to write language, they'll work with a legislative council staff member for that. They'll then what's called drop it in the hopper, or there's other terms, but give it to the clerk. There's actually a hopper in front of the clerk at the floor of the individual bodies, this House and Senate. And then that gets sent to committees. And then it has to go through a committee process of subcommittees, a health subcommittee, and then a full committee where they'll debate and vote on that legislation. In some cases, there's no guarantee that the committee will pick up and vote on or even debate a bill. The immuno bill, for example, has had hearings and has passed out of one of the committees, for example, in the House. The Living Donor Protection Act has not. A lot of that is whether or not there's enough people pushing the legislators on that committee, for example, to move that bill forward, if there's enough of a coalition of advocates. Once a committee passes the bill out of the full committee, it goes to the floor. At that point, it's up to the leadership of that particular body to pick up the bill and move it as its own bill. Sometimes bills will move quickly because they're non-controversial, and they'll either be lumped into a big pot of bills that are non-controversial and moved, or they'll just be quickly voted on and moved on. Sometimes bills will sit and die on the floor. Sometimes a bill will wait for the right vehicle, because legislators will and the leadership will sometimes like, again, to clump legislation together to move various bills together that are similar for a number of various reasons, depending on the legislation. And then once that bill is passed, You have to go to the other side of, if it's not running parallel, you have to go to the other side and do the entire process again before you have both committees passing a bill. You have something, if they're different for whatever reason, they have to go to conference, which is yet another committee. So you can see how complex this is, even just in a basic discussion. And a select group of legislators from the House and Senate will discuss the differences and they'll hash out a deal. And then they go back for yet another vote on the compromise package. If that passes, it goes to the president for signature, and then hopefully is signed and becomes law. If the president were to veto it, it dies there, and Congress can either override the veto or they can try to pass it in different form, which requires going through the process all over again.
Andrew, do you anticipate any that we're going to be able to advocate and get attached to any of, let's say, the COVID legislation, et cetera, either the immunosuppressant bill or the Living Donor Protection Act? And therefore, our emails would be very important in the next couple of weeks, or
yeah. Yes, there are a number of, we'll call them bills, that some of our priorities could be attached to, such as, I'm going to call it the immuno bill, the compromise, just because it has a really long name, Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act. The immuno bill, for example, because, as some of you may know, so many people with COVID are at least temporarily acquiring acute kidney injury. The statistics are showing up to 30 to 40% in some areas, and if someone has to be admitted, it is definitely as high as 40% of people who are admitted to an ICU for COVID end up with kidney injury. And we don't know yet whether that's permanent, whether they're going to require dialysis long-term in many cases, whether there's damage that's long-term, but they get off dialysis for a few years, so on and so forth. But because there's such a great connection between kidney disease and COVID, there is an opportunity for us to, for example, move the immuno bill in the next COVID package if they allow amendments, which is still being debated. They might move what's called a clean bill, which means there's no amendments, no discussion. It's going to be what the original language is, and that's it. If they allow amendments, we're pretty confident that the immuno bill will be included. If that does not happen, there will be what's called a Medicare's extenders bill later in the year, as well as some other opportunities out there for that particular bill. With appropriations funding, that's not usually the case. They'll usually group all the appropriations bills or a series of appropriations bills together, but they will not usually, they can't move those as attachments to other legislation.
So that follows up. Richard Masterson is asking, is there somewhere that's published where we can kind of see the progress on the bills you talked about? And I'm going to add, Richard, can we see where our Wisconsin senators and representatives are? Where would we find that? So if we wanted to check on what's going on with the Living Donor Protection Act, or we wanted to see what's going on, like, do we have Wisconsin? So for instance, Ron Kind, I'm aware, is a supporter. But I don't believe our senators are signed on to any of the three bills. Is that correct? And where would we find that out? And then Ron, I see you have Ron Walsh a question, and we'll get to that. But I think Richard's seemed to fit in with what Andrew was talking about. So sorry, Ron, I skipped you in line.
Yes, Ron Kind actually has been our primary driver for the immuno bill for a very long time. He, along with a Texas Congressman, Michael Burgess, have been the two steadfast champions of this legislation the entire time that we've been trying to move it. So if you do meet Congressman Kind, please thank him for everyone. So your first question was how to look
how do we
up.
see, how do we see
How do you look
where
up?
the bills currently are? And is it on the NKF website that we could see who's on, who's not?
There's two really great sites for this. One is by the Library of Congress called congress.gov. And what you would do, you type in congress.gov in the search in the nav bar, you type in like the bill number or the name of the bill, and it'll come up with, especially if you put the bill numbers in, it'll come up with a lot of information. Like you could read the text of the bill, you can see what committees it goes to, you can see what actions have been taken on it. You can read summaries of the bill. You can also see who are co-sponsors of the bill. And then you can also see if there's a related Senate or House version if you're looking at one or the other. So yeah, as he's typing in here, you can click on HR 1224 underneath the word bill there, for example. And it would pop into the site. It's next to one, right. You see the word in red, bill, underneath there, there's a link to with the bill number, right underneath that, right there. So you can see there's a lot of information here. The other really great site is called govtrack.us. And it allows you to do a lot of the similar research but on the bills. You can also get automatic updates if you happen to want those. You can also look up information here on your legislators as well. So this is not a government site. I believe a nonprofit runs this, but it is a fantastic resource for anyone who is wants to look up the status of legislation, whether their legislators are on board the legislation, whether if there was a vote, how they voted, so on and so forth. For our bills, you can see, for example, who is co-sponsoring. If there had been a committee vote for the immuno bill, for example, that would be reflected. You could see a roll call vote. However, because it is non-controversial, everyone said yes, so everyone voted yes, which is, it's not controversial. With that bill, basically, as I kind of said earlier, it's one of those bills where everyone was just saying, I can't believe this is the case. No one's going to argue against this. And that, everyone supported it. So what was the other half of that question? I forgot. I apologize.
Well, I did too, because I'm old. I think that was it. So should we be contacting, because our federal folks have local offices, correct, in Wisconsin? So when you were talking about meeting with people, we all aren't going to just fly to Washington, D.C. right now. So should I also reach out locally, or? And then the other question I had is, who really reads these emails when you send them? Are they staffers in the office? And can you talk about how how does it make an impact? Do they let Tammy Baldwin know that 20 people sent something after tonight's meeting?
So, yeah, I can answer. Let me write down both parts of that.
Yeah, sorry about that. I have a stream of consciousness.
And so let me start with the reporting, then we can get to the other part of this. Legislators will typically get a report from their staff, usually Mondays or Fridays, of who has written in or called into their office. So, what will happen is if, let's say, they've received 100 letters on the immuno bill, that will pop up to the top of that list because very few bills get 100 people writing in them any given week or any given month in many cases. And that report will show that. Now, one of the reasons I pushed personalizing your emails is because a lot of this, as you can imagine, legislators can get tens of thousands of emails a week, definitely a month, depending on what level they are. I think I've seen statistics as high as 70,000 communications in 1 month for a particular Senate office last year. I've seen even higher in some peak cases. So when you're getting that much mail coming into your office, you use automated systems to sort a lot of it, especially emails. So what a lot of these systems do is if you personalize about 30 to 40% of that email, for example, if it's a 3-paragraph email and you add an extra paragraph, it will be moved to basically a separate folder for personalized emails, because it's not just someone sending the stock email whereas if you personalize it, that email has a better chance of getting read and has a much better chance, excuse me, a much better chance of getting onto the desk of the member of Congress, the senator. You know, in the office I worked in and a lot of other offices, for example, they'll select a series of letters that have come in for the legislator to read every morning, for example. So if you've personalized that letter and it's something that catches their attention, that letter may get onto the member's desk, and that is more likely to be attract attention than if it's just a stock email with no customization. You know, when people just send a stock email in, that's when you need those 25, 50, 100 emails to go in a short period of time. And that's one reason why we push meetings at the district level or federal level. This is not a weird year, of course. You're not flying to DC, and we would never ask you to fly to DC, let alone get on a plane these days. But that doesn't mean that you can't, for example, do a meeting virtually, as we're going to be doing next week with advocates, with your legislator's office in DC or in district. The DC office tend to focus on policy. The district office tend to focus on more of the constituent connection, constituent interest portion of it. And that's a good way to, for example, invite someone like Cindy to participate, to talk about the community and impact of kidney disease on the community, as well as the policy. And as important as those letters are, the biggest impact you can make is having that meeting with a legislator or their staff. And if you can catch a legislator before they're in office, there are a lot of legislators retiring, for example. I don't know if there are any retiring in Wisconsin right now. But for those who are, the chances are, you know, one party or the other is going to win. A lot of districts have been gerrymandered, unfortunately. Forgive me, taking off the NKF hat and saying unfortunately there. So you know if a Republican or Democrat is most likely to win, and you could have a chance now to get in on the ground floor of the education process before that person becomes a sitting legislator. But even if you don't necessarily know if they're going to win, this is a good chance to go in and educate them and their staff as well, their campaign staff, about the importance of kidney disease, the impact. With our advocates, we actually encourage them to also try to invite their legislators to their dialysis clinic, to a transplant department, to some other place that they can experience a little bit of the kidney patient's life, or to a walk. I know walks are virtual now, but that doesn't mean that you can't invite them to participate in a virtual walk, or to participate in some other event that Cindy is running, that they can speak with their constituents who are also kidney patients. And sometimes they're great because they show just how many people in the community have kidney disease, and that can make a huge impact. In the case of Atlanta's mayor, who became so invested because she realized just how many kidney patients were in and around Atlanta, so that the next year she not only hosted a kidney screening in the mayor's office, but she also, for example, did robocalls and did emails to highlight the walk to help drive people out and participate. And she also participated in the walk herself. I think she might even have had her own team.
So Andrew, we're kind of coming up on the end of our time, and there's a couple other questions. I assume that they're on a state level. There's similar types of websites to track bills, to see there might be some issues as it relates to healthcare or chronic disease, or even transportation, or a variety of things, even in a state level. How would one find that if I wanted to find out if there were similar websites that you know, that I might find out what's going also on in my state?
Sure. The best place is the Wisconsin State Legislature's page, which is legis.wisconsin.gov. You can just Google Wisconsin State Legislature. And they will have, you'll be able to find out who your legislators are, for example, at the state level, but you'll also be able to find out what legislation is going on at that level as well. There are other websites. I don't know that GovTrack covers state legislation. Honestly, it's been a while since I looked at that level, but there are sites like Ballotopedia, which is out there and does have some information on legislation, on legislatures and legislators. But that tends to be that information tends to be a little more dated, unfortunately.
And so John, who's a much better typer than I am, because obviously I put some periods in there in the chat, everyone wrote that it's legis.wisconsin.gov.
Yeah.
And thank you, John, for being a better typer than I am. And then Andrew, I think there was a question from Ron Walsh, who you have met, who's a living donor, but it's very specific to some insurance as it relates to his donation and paying. And Ron, I'm happy to address that question kind of offline for you, but I'll say that it has to do kind of also with the age of Laura when you donated, and the fact that you did have primary health insurance, but I can talk with you more about that kind of offline. But so Andrew, I want to thank you very much for joining us tonight. There seems to be, I think, a couple other messages. Oh, Ron said okay, that he'll talk with me offline. And then John did put ballotpedia.org in the chat for those of you that are able to see that as another resource that Andrew talked about. But Andrew, if there are other questions, I'm just going to encourage people. They could certainly feel free to email me and I can forward those to you. I know this is a busy week for you. But John, if you could move to some of the other slides. I just want to first of all, Andrew, I want to thank you for spending a very informative hour with us. And I think right now, voting is, you know, a message we're hearing a lot. And so I appreciate you taking time to talk about how we can still use the next 3 months to make change for patients throughout the country, and that our voices are still as important today, even though there's lots of, it might seem like there's a lot of other noise going on, and maybe kidney stuff or immunosuppression or living donation, like, you know it's important, but maybe we think maybe it's not as important as some other things going on, and you really reinforced that we should never, ever, you know, we have to be relentless in our pursuit. We've worked too hard. So I just want to let everyone know that for those of you that did join us tonight, you'll get an email with a link to a little mini survey just to kind of give us your feedback about the program tonight. And you certainly can add any questions on that survey, and certainly any ideas for future program topics. Then I just want to let you know about a couple other things that are coming up. We're really, as I said before, we are offering monthly programs, and so you can see that these are the 2 dates of our next programs coming up. And so go back, if you could go back, yeah, hang on that one just a minute, John. We're going to kind of talk about, I think Andrew brought up the concept of voting safely, and, you know, making decisions and how we can still engage and make our voices heard. We're going to kind of follow that theme in terms of next month's program, and we have 2 folks from one of Wisconsin's transplant centers joining us, both a social worker as well as a transplant coordinator, to kind of talk about also how our holidays are potentially going to be a little different, or how we can make them a little safer for those of us that might be immunosuppressed or have family members that we're concerned about, but also then psychologically, how do we maintain the energy, enthusiasm, or however you perceive the holidays with family and friends, how we can, how that might be different this year. And then, because I love food, we're going to focus on food in November, because I like food. And so we have 2 folks, a recipient and a dietitian who happens to be a living donor, who are going to kind of talk about some holiday traditions in a little bit different ways, and show some kind of cool, interesting recipes. Next slide. So next week, I also wanted to let you know, because I know many of you share information and have very vibrant personal networks, and wanted to let you know that our Living Donors Together group has 3 very interesting programs focusing on the different types of living donation. I'm sorry, John, if you could, there you go. Next week's program, you can see, is going to focus on the concept of just paired exchange. Then the subsequent programs will, and you can go to our website, you'll see one program will focus completely on donating, if you will, in terms of familial kinds of donations, and another evening we're going to focus totally on altruistic. So real people and real recipients will be talking, but please share this, especially if you know folks that are waiting for transplants. But it really is a great opportunity. Next slide, John. Thank you. And then we also did record tonight's presentation for some of you that perhaps might not have been able to see the slides, or want to listen to some of the information again, or would like to just forward that along to someone else that you know really is committed to advocacy and making a difference, and is willing to share their story. So that will be available on our website with Amanda and John's help. We're very appreciative, and we hope to have that up by the end of the week. And I believe, John, we're at the end of our slides. Is that correct? Oh, I get to talk a little bit because the holidays are coming up, and so one way you can easily support us without, all you have to do is shop, and that is to select the National Kidney Foundation of Wisconsin as your charity of choice. And no matter where you are in the country, or anyone you know in the country, the Kidney Cars program, which is the next slide, by calling that number or visiting that website, you'll be helping patients within that state. So wherever a car or vehicle is donated, the National Kidney Foundation local office in that state will benefit from the proceeds. So I would really encourage you to share this with family, friends, no matter where they are in the country. You can help us maintain our efforts throughout the country by just telling people about our Kidney Cars program. And so I want to just thank you again, Andrew. Thank you again for joining us. Everyone, please stay 6 feet apart from those you care about, and especially those you don't care as much about. It's so important, as we all know, to do our part. But thank you so much for joining us tonight, and I hope we'll see many of you next month. Have a great evening.